Hey, hi there again. I'm Gabriel Diaz and this is Dealing with Pain Patching Techniques Series Part 2. And I'm very excited to present this next topic of the series, low back pain specifically for chronic cases. And I gotta tell you that I was one of the main testers of all the techniques presented here because I had severe low back pain and sciatica issues myself since my early 20s. And this is the very first area I became very good at with the patches. I remember one case in particular back in 2009 where the father of a very good friend of mine had chronic low back pain for over 10 years. And after having dinner with them at their place, I started patching. And around 1 hour or so later, my friend and her father were dancing of joy because her father had no pain at all, just by using some of the techniques included in this video. So I will leave you now with Dealing with Pain Patching Techniques Part 2, and I will be back on Part 3. Enjoy it.
Hi, and welcome to Patching Protocol training videos. This is a video protocol and is part of our Dealing with Pain area. Patching procedure for low back pain, chronic cases. It is a fact that chronic low back pain is considered today a common symptom in our modern life, which unfortunately undermines our ability to work at our full potential, causing discomfort like pain, obviously, physical stiffness, and perhaps tingling. In other words, it does interfere greatly in our daily activities. There are studies confirming that acupuncture offers a safe option to relieve pain, to restore functional impairment caused by low back pain, and therefore improve our quality of life. The good news is that Lifewave technology offers a great opportunity for us to deal effectively with lower back pain related issues. The question is, how do we go about it? Now, it is interesting to note that there are 4 main acupoints that have been tested and are most commonly used in cases of low back pain, and those points are governing vessel number 3, or GV3, governing vessel number 4, or GV4, bladder number 23, or BL23, and bladder number 40, or BL40. Right below this video, you will be able to refer to a more detailed description of each point, but right now we will talk about the initial setup. Firstly, we place a glutathione patch on GV4 position. Next, an AON patch on GV3 position, followed by 2 Icewave pairs. One pair on BL23 and the other pair on BL40. Remember, WRTL, white to right, tan to left. We have now covered the 4 main and initial points, and to complete this initial setup, we will add 2 more patches. One single AON patch on governing vessel number 14, or GV14, and another single glutathione patch on conception vessel number 6, or CV6 position. The initial setup for us to work on any chronic low back pain is now completed. This will be a full image of all points involved. We need to make an important note here. There are simpler approaches to take in general cases of low back pain, which will be discussed later in this video. However, as you can imagine, low back pain has its complexity due to the amount of functional parts involved. With this in mind, we are attempting to create a base for chronic low back pain cases, and from there on, anyone could then test different approaches according to its specific condition. Also, according to our numerous tests on ourselves and others, the low back pain initial setup protocol presented here has shown great results in a majority of cases, without the need of going further or adding any more positions. Once again, it will all depend on each individual situation, and it will be a matter of testing it. Now, in cases where pain is reduced in some degree, but still yet to be at the desired level, we suggest the following 2 approaches. 1, the buttock approach, and 2, the pain blocking and stacking approach. The buttock approach. According to the acupuncture literature, there are 4 other points located at our buttock, and all are related and recommended in cases of low back pain or lumbar region related issues. Those points from top to bottom are lumbar eyes extra point, bladder number 53 or BL53, bladder number 54 or BL54, gallbladder number 30 or GB30. Please refer below for more detailed descriptions and how to locate each point. The buttock approach procedure. With all the initial setup points in position, you could place an Icewave or energy enhancer pair on the lumbar eyes extra point, wait for 5 minutes, and then move it to the next position below. Do pay attention on any changes in the level of pain. If the level of pain remains the same, repeat the procedure at the next position below. If you find that at any of the 4 points the level of pain decreases even more, you could do the following. Let's say, for example, that at the BL54 position we notice a reduction in pain. You could then take a single carnosine patch and stack it over the Icewave or Energy Enhancer white on the right side at BL54 position. Then you could also take a single Aeon patch and stack it over the carnosine patch on the right side at BL54 position. Now you will have a triple stack on the right. Wait for another 5 minutes, and if the pain does not change, take the carnosine and Aeon stack and move it to the left side and over the Icewave or Energy Enhancer tan patch. The procedure has shown further improvement on the level of pain at the low back area. Alternatively, you could place 4 pairs of Icewave or Energy Enhancers at once, one at each position, and then move the carnosine and Aeon stack around at both sides in 5-minute intervals. The pain blocking and stacking approach. If the buttock approach isn't favorable on your case, you could use this next approach. Now we will concentrate on local points located along the spine at the lumbar region. For this approach, we will need 1 full Y-age triple stack. That means 1 glutathione patch, plus 1 carnosine patch, plus 1 Aeon patch, all 3 patches stacked over each other. The pain blocking and stacking approach procedure. With all the initial setup points in position, locate the point of pain. For example, we could say that the point of pain is at the L4 area. Then we should remove the Aeon patch previously placed and place the Y-age triple stack at the point of pain instead. Now we start moving all patches upward 1 thumb width at 5-minute intervals. Going as high as T9 or right at the middle of the back. Then we could do the same procedure by moving downward of L4, also 1 thumb width at 5-minute intervals, and going as low as reaching the tailbone level. This approach is, as you can see, a more time-consuming one due to the large area to cover and the number of positions to move to. However, it has shown very good results in severe chronic low back pain and slip disc cases where other protocols didn't work as well. Other simpler approaches. If your low back pain case is not as severe, you could start by testing the following approaches. The spine bracketing approach. Take an Icewave pair and place the white patch on GV14. Next, place the tan patch on your tailbone. Alternatively, you can use an Aeon patch on GV14 and a glutathione patch on your tailbone, or even stack them over both Icewave patches. Whichever option you use, it's recommended to add another Icewave pair at K1 position to achieve a better result. The double triangle approach. Using the same spine bracketing approach, just add an Icewave pair on BL40 position, forming a double triangle, as you can see. Lastly, the double inverted triangle approach. Using the same spine bracketing approach, just add an Icewave pair on BL23 position, forming a double inverted triangle, as you can see. Alternatively, you could move the Icewave pair on BL23 upward or downward, a pain-blocking technique, testing which vertical position gives a more favorable result. All 3 approaches have shown good results in different situations. Final thoughts. We do understand the complexity of the information presented here, which might be a very testing procedure for new and even experienced Lifewave patches users. Please do take your time to comprehend all the mechanics of each approach. Also, we recommend reviewing this video in several occasions. Read all the detailed information below and try to get familiar with all acupoint positions used before you start patching. What can you expect from all these? A very fair and understandable question, especially for those new to Lifewave technology. If you had the opportunity to watch our first video series, The Lifewave Journey, we have suggested on video number 1 that the goal of Lifewave is to rebalance the energy flow in the body in order to make all systems function properly and thereby start the healing process from within. When dealing with conditions where imbalances have been progressing for a long period of time, as are a great majority of chronic cases, regaining balance will depend on several factors, like the approach used, consistency on applying those approaches, and the level of personal interest to achieve good results. We are constantly experiencing cases where low back pains take minutes to achieve a positive outcome. Others take hours, days, and even months to show a general improvement. Everyone has a different set of conditions, but those who experience good results are sharing some common denominators. All individuals are highly motivated to regain back their balance. They keep testing options till they find their most suitable procedure. They create a consistent habit and endured patience, focusing only on positive results. So as you can see, Lifewave technology opens a great opportunity for us all to find the most suitable way to regain our balance applying a few basic concepts. Our job is to understand how these basic concepts are applied on our own particular case. Patching Protocol wishes everyone a happy patching and a prosperous path to achieve their desired results. Thank you. All procedures using Lifewave patches included in this video are with the intention of providing ideas and general guidelines of some of the possibilities available. PatchingProtocol.com does not make any medical claims using Lifewave patches and does not take the place of proper diagnosis and treatment by a properly licensed healthcare professional. Members and non-members are strongly advised to consult a qualified practitioner concerning specific treatments to their particular case. In other words, we're not suggesting that you should stop any health plan you are undergoing at the moment. Our intention is to equip anyone with a certain level of understanding that a new technology which it could improve or preserve anyone's health is available, and it might be worth trying it.